This is Dr. Chris Robertson. This is going to be week 2 content, which covers the DNP project development in regards to the problem, purpose, innovation, and theory, and also going to include a component with social justice, health disparity, and health equity. So, the DNP project development, as you put it together in this course for research translation, includes the portion of the manuscript 1 through 7. And so you start that out with section 1, which is your background and significance. That is pulled over from your literature review that was completed in research and evidence-based practice. Everyone whose lit review was graded, and that was everybody, received feedback. And so it is expected that you're taking that feedback and incorporating that into this assignment, or the first portion that's going to be due, sections 1 through 4. The second section is your purpose statement. Many students did start developing a purpose statement. It was more focused on that time of doing a literature review and what they were identifying through that literature review. At this point in time, as we shift with the focus of the course, that purpose statement will evolve to become the purpose statement of the project. The third section is the QI, evidence-based practice intervention, which is your practice change, also known as the innovation that you're going to be implementing. As literature was reviewed towards the latter part of research and evidence-based practice, you began looking at what types of solutions exist to the problem that was detailed in the background and significance. And you critiqued that literature and identified one intervention that you felt like would be the best solution based on the level of evidence, based on its prior success, and also based on it being applied in your practice setting and how feasible it was. Lastly, there was a theoretical framework. And this was essentially you looking at your problem, looking at your solution, looking at what types of concepts you had going on in your study, and identifying a theoretical framework that would guide your study. And we'll talk about that a little more in a minute. So, background and significance problem. What is this all about? This introduces the phenomenon of interest and problem. This is not news. You all have taken research and evidence-based practice, so this is a recap and opportunity to refine. Essentially, the phenomenon of interest is the topic. And so when you're doing the background, you are giving background information and giving the state of that project, the status of that, the state of that topic or the status of that topic. So how frequently does it occur? What did you learn about it in the literature? Is it within the realm of nursing? Is it within the realm of advanced practice? To be able to address, and is it something that's feasible? And then with the significance portion, why is it important? So tell me about it, tell me what it is, and tell me why it's important. Again, the phenomenon of interest is a topic. It may be hypertension, obesity, mobile health, it just varies. But essentially, you are identifying an area of clinical concern that requires some more research or some more improvement. And you're also going to be helping to ensure the healthcare needs of patients or populations by addressing that particular clinical concern. As stated previously, it's important that you select a topic that is meaningful And also one that's valued by the practice setting. This is not, one, the topic should be generated out of your practice. And two, it needs to be something that you're going to have support with from the practice site versus you having an interest in a topic, developing a solution based on evidence, and then trying to find a site that is willing to allow you to implement because you've got this awesome project. It may be awesome, but if they do not value it, you're not going to get the support and the buy-in that you need, and you're going to have issues with implementation, which goes back to the whole concept of implementation science, which is a major component of research translation. You also want to consider your areas of expertise. And when you're in that practice setting, consider what types of issues are going on that require further inquiry. And my hope is that these are the types of things that generated your initial practice-based inquiry. If not, then you can always go back and consider it if you need to refine your problem or narrow it some. So once you identify the clinical problem, obviously it's within context to the needs of the organization or the population. As some of you experienced during research and evidence-based practice, the topic of interest may morph a little bit. Some of it depends on where the literature leads you. And it's important even now as you begin to narrow your focus to do so, but not to do so too much. So if I say I'm looking for Asian Americans age 30 and they have a prosthetic eye and an amputation and high blood pressure, if I say that's my population, I have narrowed my focus way too much. To be able to find the needed sample to have an adequate sample size based on my power analysis is going to be extremely challenging. Some people obviously are focusing on particular races, and that's valid based on the literature and based on the evidence. However, in that regard, you want to make sure that you're not narrowing to where you're never going, or it's going to take a longer amount of time to reach the numbers that you need to reach in regards to sample size. So if you're working with a population where African Americans are disproportionately affected, and I say that, I use that population because it's what I see most, and you hone it down to African Americans that are female, that are age 25, that have a particular condition, unless you're in a setting that has a plethora of that particular person that you've described, you may have challenges recruiting. You may have challenges maintaining the sample size that you need. So just remember to narrow, but not too much. So your understanding of the topic should definitely come through as you, or as I'm reading your background and significance section. I should understand the topic, and I should also understand why it is important and what about this topic is concerning. So understanding is the background, why it's important is the significance. Also consider, as your text pointed out, it provided a theoretical model in terms of looking at the topic of interest through different lenses. So this is called the patterns of knowing, or the ways of knowing. And so essentially it encourages you to look at the particular topic through a certain perspective so that you gain insight and you're better able to describe or explain it. And so the patterns of knowing talks about various types of knowledge, which are listed up here. Empirical knowledge is what we lean on a lot. It's organized and general laws and theories, and it describes, explains, and predicts. Aesthetic knowledge has more to do when we as nursing professionals use our skills of empathy and caring, and we are engaged with the patient and we are attentive to patient experience. And that's so important. One of the things that we discussed last semester in research and evidence-based practice was the need to make sure that you are considering multiple sources of evidence. And included in that multiple source of evidence is the patient experience. And I think the majority of students were really good about making sure, even in doing their literature reviews, they looked at some qualitative studies or mixed method studies that included some qualitative narrative or what have you from patient experience. That is important because you need patient experience to help shape care to meet some of those aims that we were talking about earlier in terms of making sure care is patient-centered. So in any event, you want to consider patient perspective. Personal knowledge, obviously, is looking at things from more of a holistic perspective as opposed to just one domain. And this is to promote wholeness as well as integrity. Ethical knowledge is based on the obligation to serve and respect for life, even when you've got the COPD patient who may be in stage COPD but continues to smoke and smoke a lot, and you don't really agree with that. Well, you still have an obligation to serve, and you still have an obligation to care for and respect that person's life and their choices. And then emancipatory knowledge has to do with the nurse reflecting on issues of fairness and considering changes or initiating changes to eliminate the injustices. So that there goes back to the concept of social justice. It brings in some of the constructs of health equity, health inequity, and health disparity. We'll have some conversation about that in a minute. So, what else is important with the background and significance in establishing the problem? Obviously, your literature is going to indicate what is known and what is not known about the topic. What is also very important is that you do an organizational assessment, which is your SWOT analysis. Again, your project must be valued by the practice setting, and part of that, going back to implementation science, is to have that buy-in from the site. And some of that buy-in occurs when you engage the site, when you reach out to stakeholders and you get their perspective. They too are another source of evidence. And so even in your SWOT analysis, which is going to occur through interviews, you have opportunity to identify gaps between the current state and their desired state. You're able to see and support what the need for change is, but also they are able to support the need for change, because it may be that they see that you better understand what their needs are, which means you will tweak and change some things. And also it gives you information about how to proceed. It informs you. The information that you get from the SWOT analysis gives you an opportunity to better assess the environment that you're going to be implementing in, so that you can identify strengths to take advantage of, or weaknesses and challenges or threats that you need to overcome. And so with the SWOT analysis, obviously you'll be looking at strengths, weaknesses, opportunities, and threats, doing some internal and some external analysis. So moving on to the next portion of your DNP proposal, which is your purpose statement. And here, this is where you're basically telling about the problem, but framing it from the standpoint of this is also the potential solution or the proposed solution or whatnot. And so how you construct this part, you can certainly start with the lead-in statement to kind of set the stage, and then declare the originality which should be supported by the literature, going back to scientific underpinnings. And you've got to substantiate the need and the gap. You've got to show what the state of it is and why it needs your project. And then you're going to explain and highlight the value of your project and share the central focus in terms of what will this project accomplish. So the below is an example. Successful diabetes management in the primary setting is a difficult, costly, and labor-intensive process that requires proven skills and lifestyle counseling. So that's kind of a lead-in. It's already telling me what's going on with the problem, what the state of the problem is. Now we're going on to the declaration and the need that is based on the literature. Although many studies have proven the value of addressing the needs of the diabetic population, there is a paucity of studies that look at clinically effective interventions or strategies in relation to cost. And then you're going into what's the value in this project and what it's going to accomplish. The purpose of this study is, and it is to assist in achieving positive clinical and cost outcomes in diabetes care. So it's very important to make sure that you're specific, but that you're also concise with your purpose statement. So moving on to theory. Why is theory important? I've had this question asked of me a few times. And so theory gives you an opportunity to frame what you're looking at. And so you ask your question, what am I looking at and what just happened? Theory puts some organization and some structure to it. It is a set of concepts and statements. I've got that in here twice, that present a view of a phenomenon and explain how these concepts relate to one another. And so what is a concept? Those are terms that describe name, object, idea, or experience. So constructs can be abstract or they can be concrete. And again, you're looking at the relational statements. The theory gives us a way to organize dynamics that we see in our topic. It gives us a way to recognize patterns and develop a patient-centered intervention. So the relational statements can at times be tested through the project or research. So if I say that my patients do not exercise because they do not feel like they are susceptible to chronic disease complications, I may be able to explain that through the health belief model. The health belief model deals with dynamics related to perceived risk and susceptibility and health behaviors. And so it speaks to those concepts which are demonstrated in my project. And so I may lean towards using the health belief model as the model for my theoretical framework. And so here in this section of the proposal, the expectation is that you describe the theory, but then you also show me how the project is exemplified and is demonstrated and relates to this theory. And so that's why theories are relevant to practice. They help us identify our objectives, they help us figure out which questions we need to ask, and they help us understand, or they help us formulate our design, which then affects our statistical analysis, and it can help formulate the types of findings we expect from time to time. So moving on to the fourth section of the paper, or the proposal, which is quality improvement, evidence-based practice, intervention, or innovation. In this portion, this is about understanding the topic, and as you understand the topic, you'll find new ideas and innovations that could possibly improve care. The biggest part here in this section is that I know what the innovation is and what is the evidence to support the practice change. And so you're definitely going to provide that evidence, but don't forget to explain to me what the practice change is. If the practice change is a particular, let's just pretend, exercise routine or a particular walking program, you need to explain that walking program to me and then give me the literature behind it to support. So DNP project development. Keep in mind, again, we'll talk a little bit more about implementation science on week 3, but keep in mind that implementation requires attention to a wide variety of human, budgetary, and technical values, and that you must also consider the environment where the project is going to be implemented and if staff are going to need a process for training. Excuse me, y'all. You've also got an element of project management because you're going to be planning, organizing, acquiring, managing, leading, and controlling resources. Well, you also focus on change management. You're going to be working with the staff at the site and involving them in the process to make changes that are required so that care can be effective and efficient. Recall those are some of the aims from the IOM. And so, because that's going to give you buy-in, and that might be done sometimes through training. In any event, you've got to plan and design, you've got to implement, and then you've got to monitor, and it just goes in a continuous circle. At some point, you are hoping that you meet those goals and move forward. Obviously, as you're working with your project team, study team, or the practice site team, you want to make sure that you're coordinating efforts. You want to make sure that you're getting the support that you need. You want to make sure that you've identified what type of resources am I going to need in terms of people, in terms of technology, in terms of material, and in terms of supplies. And what are potential issues, and trying to problem solve about those issues before they become a barrier to implementation. So who may be on your practice site team? Essentially anyone who has something to do with your project. And keep in mind, I'm being very clear with the verbiage in terms of practice site team. So you're going to have your project committee, but you're also going to have a small team of persons at the site that are going to help you navigate things. And if you run into a situation where something comes up and you're not sure how to handle it, you've got these resources available to you at the site. So, what is social justice? And why do I have to make sure that it's evident in my paper and in some of the assignments? So let's consider health disparity. Health disparity is a disproportionate difference in health between groups of people. And so that's just an observation. When we start talking about health and equity, we start dealing with more, I'd say, social determinants of health. These are differences in population health status and mortality rates that are systemic, pattern, unfair, unjust, and actionable, as opposed to random or caused by those who become ill. So these are things within our healthcare system that may create this sense of partiality. And then you've got health equity, which means a fair, just distribution of the resources and social opportunities needed to achieve well-being. And so when you think about your problem typically has a component of health inequity as well as health disparity. And when you start thinking about your intervention or your innovation or your practice change, you've got the health equity component, which ultimately promotes social justice. And so think about your project. If you're doing, this is not going to make sense, but just for sake of example, let's say you're doing gout in 45-year-old men who identify as women. You've got a good bit of health disparities right there and health inequities. One of the issues, even in data collection, is inquiring about transgender population. We don't know what their health issues are because we don't ask how people identify in regards to their gender. Just because someone's sex is identified as male or female doesn't mean that their gender is male or female. They may identify from a gender standpoint as something different. And so there are health inequities and health disparities among transgender populations. And so if I'm looking at whatever a major health issue, it may be related to mental health, it may be related to abusive relationships or what have you. But whatever I'm looking at, that's my health disparity, my health inequity. And so the health equity and the social justice part come through with your practice change. And so seeing that your practice change is a potential solution to the problem is what we're looking for, but we're also looking to make sure that you're addressing those things that contribute towards the health disparity as well as the health inequity. And so what do I mean? So health inequities, those are social factors. Health disparities, that's health status. So you have, again, this is another theoretical framework, but you have just a plethora of things that are contributing to health. Social determinants of health, I think, yeah, here we are. But you have these social determinants, and I don't really like this slide, but we'll go with it for now. You have the social determinants, and you can see access to care, just access, plays a small part in overall health. Physical environment plays a small part, but you can see that healthy behaviors plays a very large and significant part. And you can also see that social and economic factors such as education, employment, income, community, these things play a very, very large part. And so part of healthcare is beginning to shift towards, we need to tune into some of these social determinants, and the innovations that we implement need to be considerate and target some of these issues as it relates to social and economic factors. And again, we're focused on quality of care, and that is important and makes a difference. But you do have to consider, what is that quality of care, or what is your system change impacting other than that small piece of the pie. And so again, just another model to demonstrate how we transform health disparities to health equity, which is essentially what should come through in your project, what should be seen. We should see the acknowledgement of whatever type of health disparity and health inequity is going on. And that could be among racial, ethnic minorities, gender, low income. It could be, as it said, among a particular race or ethnicity, men, women, or whatnot. And obviously we are a part of that solution, but ultimately goes down to decreasing or eliminating health disparity and promoting health equity. And so that is the end of this presentation.